I am the medical director for children's integrative medicine at St. Luke's. I came here about 4 years ago, almost to the day, from University of California, San Francisco, where I was doing similar work. I was doing integrative medicine there at the Osher Center for Integrative Medicine, which is where I did my fellowship in integrative medicine and then was in residency for peds before that and stayed on as faculty for a few years at the Osher Center before then transitioning over here. And I see a really wide range of patients in my practice that have chronic health conditions. So everything from neurobehavioral conditions to chronic physical conditions, chronic pain, some mental health, a little everything under the sun, basically in the chronic realm. And my approach is around what sort of non-pharmaceutical things that are also science-backed can we do to help optimize health. And I always tell families, and should tell you guys too, I'm absolutely not against medication in any way. I always tell, like this can be in combination. It's just that my lens in terms of how I'm trying to help is what is the other stuff too that we can do in combination with medication or if it's surgery or whatever else. So it's always the standard of care, plus like what lifestyle and non-pharmaceutical options do we have to help optimize things as well. So, um, yeah, so we got my slides up here. I'm going to be talking about how to support parents who want to explore complementary and alternative, or also known as CAM therapies for autism. Some learning objectives today. So one, to understand the patterns of use of CAM in kids with autism, and also discover some of the common therapies that are used in children with autism that are CAM related. Think about how to evaluate safety and efficacy of CAM therapies in autism, and also be able to discuss safety and efficacy of these therapies with the families of these children. And so just to go over some patterns of use, so CAM is really a popular therapeutic option for families of children with autism. And, the majority of families really are using CAM, whether or not PCPs or other physicians know about it. I would say there's a study that was done that reported 52% of parents with a child on the spectrum were using or had used in the past at least one CAM therapy for their child versus 28% of a control group with healthy children. Other studies have reported up to almost 75% of families with an ASD kid have used at least one CAM therapy. And 70% of the therapies used, you might wonder, like, what are these therapies that they're using? They typically are supplements or special diets. But there are other things too, and we're going to go through some of those today. In this study that was done, about 75%, or parents felt that about 75% of the therapies were actually beneficial. And it's of note that even before diagnosis, another study suggested that around 30% of children have already received a CAM treatment, and 9% of this group has used a potentially harmful therapy such as chelation. So what is CAM? There's a lot of definitions out there. The National Center for Complementary and Alternative Medicine defines this as a group of diverse medical and healthcare systems, practices, and products that are not presently considered to be part of conventional medicine. And it's important to note that CAM is really a fluid concept. It's defined differently depending on the group or the organization that's defining it. Despite its convenient brevity, catchiness, the word CAM has some, the brevity, I think has some unfortunate implications that it really suggests that there's this homogeneity amongst the practices that are included under this term, which really isn't true. And that it also implies that there's a clear and complete distinction between conventional and CAM systems of care, which is also, I would say, inaccurate too. Next slide. So how do we evaluate the safety and efficacy of CAM therapies? Unfortunately, there's a paucity of data regarding the efficacy of CAM in ASD. And in the data that's available, there's lots of variability in the quality of it. So when I think about CAM therapies for ASD, I really think about it through a safety efficacy rubric that we might also use to evaluate any medication or surgical option. So my recommendations for families really center on box 1 there, that's in purple on my slide, the effective or potentially effective based on small studies that we might have, and also safe category. I really look out for red flags in box 4, that red category on the slide. in families' reports or histories around their usage of therapies or their interest of therapies in this category. And I often will preemptively warn or advise against some of the therapies that are common in this category as well, that are out there commonly, used or interested, people are interested in. Um, there are quite a few therapies that I would say fall into category three, box three, which is the ineffective but with reasonable evidence to suggest safety category in the autism CAN world. But the harm in these instances might be financial, however. Um, I can't think of anything to name for box two for autism that's effective but with danger of serious effects category. This tends to be more of a frequent category, I would say, for mainstream medicine. Okay, next slide. Some go-to point of care references that you might want to have at your own fingertips that I use frequently to evaluate any number of things that might come up. I haven't heard of everything out there. I constantly have brought things by patients that are, have you heard of this? Do you know about this? And, I often haven't heard of something that they found on Instagram, for instance. And so one of the ones I really like is Natural Medicine's comprehensive database. It's St. Luke's Library has this free. The online version is actually updated daily. There's a print version you can get that's updated a few times a year. There's also another great site that's subscription based. I don't think it's available through St. Luke's Library, unfortunately, but they do product evaluations, including lab testing of ingredient levels of supplements, things like that. There are safety warnings that you can find on either of these databases as well. Adverse reactions, interactions, that kind of stuff. These are great to just be able to quickly look up a product or ingredient that you might not have, at your fingertips and knowledge about what it is that somebody may inquire about. So next slide. I also like some of the NIH resources around safety, which I included here. There's some safety, one up there at the top, safety info. It's an article around some select therapies and supplements, and then there's an alert and advisory page that's helpful to check out sometimes. And then there's some child-specific NIH CAM resources as well that you might want to take a look at. Next slide. I often, families come to me or to, maybe to you guys looking to CAM for a safer treatment option for their child with less side effects. And I think a good example might be that, parents may be hesitant to start something like Risperdal or other psych meds for behavioral aspects of autism. They may come to me with the hope of finding an alternative to these meds. And I always remind families that natural is not synonymous with safe. And, an example I sometimes give is that a teaspoon of castor oil will make your bowels regular, but one castor bean can cause you to bleed out. And it's been estimated that, a quarter of modern drugs are derived from materials and plants, which contain really potent chemical compounds in large numbers of them. So it's not always the safest thing to go quote unquote natural. Next slide. So I want to talk about some examples of safe and possibly effective CAM therapies for ASD to start. When I think about this category, when I talk to families about this category, I'll tell them that, there are small studies showing that some patients appear to have improvements after taking or doing X, and that it appears safe based on the studies we have without any major side effects. If you're interested in trying this for your child, these things in this category may include some supplements, some dietary approaches, music therapy, sensory integration therapy, just to name a few. On the next few slides, I'll go through some of these more specifically. So next slide. In terms of some of the supplements in the safe and possibly effective category, one is using vitamin B6 and magnesium in combination. Some studies have shown that this combo may improve behavior and communication in children with autism. Another is methylated B12 injections, which shows there are some studies that report behavioral improvements in some children with autism, particularly in communication, social interaction, and attention. And then next slide, a few others. Folinic acid has shown promise in improving verbal communication, reducing some of the core symptoms of autism. Omega-3 fatty acids have also been associated with some improvements in hyperactivity, kind of ADHD features, social skills, cognitive function in children with autism. And melatonin has been shown to be effective in improving some children's sleep disturbances, which are common in children with autism. Um, Next slide. So safe and possibly effective dietary approaches. So with regards to this category, there are a lot of anecdotal reports out there of improvements, which has not translated to consistently verifiable results in the studies that have been conducted. One RCT showed that a gluten-free, casein-free diet may improve behaviors in autism, but the results were not significant for improvements in core autism features. Another study has shown that it didn't demonstrate significant improvements in core autism symptoms in a gluten-free, casein-free diet, but it did report some benefits in secondary outcomes like GI symptoms. Overall, the evidence for elimination diets remains pretty inconclusive, with much of the reported benefit being either anecdotal or limited to secondary symptoms like GI or other behavioral issues, rather than core autism traits. And I think we need probably larger scale, more high quality studies to investigate the efficacy of using these to actually treat core autism symptoms. I tell families that, if you're interested in exploring the possibility of using an elimination diet, please make sure to consult with a healthcare provider or a dietitian to ensure balanced nutrition while doing this, and also growth monitoring. That would be important. Next slide. So some therapies that are possibly effective, safe also. So music therapy, there's been some research showing that this can improve social interaction and communication and behavioral outcomes in children with autism. And then sensory integration therapy has shown promise in enhancing daily functioning and reducing maladaptive behaviors in autism. So next slide is ineffective and high cost, I would say, but likely safe CAM therapies for ASD. So what I say to families in these scenarios is this is often they'll come to me with they're already doing this, or this is something they're pretty set on trying, and that's how that something in this category comes to my attention usually. um, Sometimes I'll preemptively talk about some of these things too, but I'll say to them, if you really want to try this, I can't stop you, but I just want you to know that it has zero evidence that it will work, and I don't want you to drain your financial resources paying for this or your time. And I'd rather you spend those resources elsewhere for your child. Some examples in this category include things like neurofeedback, which has shown some applications for other conditions such as ADHD, but research supporting autism is really lacking. This involves training the brain to regulate its electrical activity using real-time feedback from EEG monitoring. And it tends to be pretty pricey, like $100 to $200 per session. Full treatment can be up to $15,000, if not more. Next slide, there's NAET. I don't really even know how to pronounce Snam-Bujrabad's allergy elimination techniques. I first heard about this through various patients, and looked into it, but it claims to treat autism by diagnosing and eliminating allergies through a combination of chiropractic, acupuncture, and nutritional therapies, and costs, pretty pricey, $100 to $300 per session, can add up over years of treatment, and there's no evidence supporting NAET for treating autism. Methods have been really, I would say, criticized as being pseudoscience. And then there's craniosacral therapy, which I get some anecdotal positive reports around certain things, and migraine headaches is one of them. But craniosacral for autism, there's no scientific basis for it. It involves light touch to manipulate the skull with a goal of improving neurologic function. And it can be pricey as well. And yeah, there's no basis for this theory that manipulating the cranial bones will affect autism symptoms, and any perceived benefits are probably placebo related. Next slide. So now to go into some examples of unsafe and likely ineffective CAM therapies for autism. So this is a big red flag category. When I hear about parents interested in trying some of these, I will tell them, absolutely don't try this. There's potential for major harm to your child, and you may want to preemptively warn families that you see who have kids on the spectrum about the dangers, particularly of chelation therapy, which is probably the most popular one that I hear about. This involves using chemicals to remove heavy metals from the body. No evidence that heavy metals cause autism, and there's really dangerous side effects, including kidney damage, seizures, can lead to death. Next slide, there's hyperbaric oxygen therapy. which involves placing a child in a pressurized chamber and delivering oxygen with the hopes of reducing inflammation and improving brain function. Despite some anecdotal reports, there's no robust evidence supporting this effectiveness of this modality in treating autism specifically, and it can cause ear injuries and lung damage and oxygen toxicity. And then there's stem cell therapy, which I have some families who've come to me telling me they've gone out of the country to get stem cell therapy. Um, very, very pricey, involves injecting, stem cells into the body with the belief that it can repair neurological effects associated with autism. And there's no evidence to suggest that this therapy is effective for autism, and the procedures carry great risks as well. Okay, next slide. A couple more examples. So Miracle Mineral Solution, also known as chlorine dioxide. It's essentially industrial bleach marketed as an autism cure, can cause severe GI damage and other toxicity. And then chiropractic, which involves spinal adjustments to supposedly improve the nervous system and behavior and symptoms in children with autism. But there's no scientific basis around using this for autism specifically. And it can lead to serious injury, sometimes dissection of the vertebral artery. So yes, okay, that sums up that category pretty well. Next slide. So some key points that I want to emphasize here, key takeaways, I would say from this, that one is that the majority of families with an ASD child are using CAM, and it may not be reported to a PCP. When recommending for or against CAM therapies for autism, I always recommend going back to the safety efficacy rubric and steer them towards the safe and potentially effective therapy category. And make sure to warn families against the dangers of unsafe and effective therapies, that category especially. And then it's also helpful to share with families that the category of the likely ineffective and also expensive, but maybe safe, can drain their resources and cause financial harm. And then when asked about the safety and efficacy of specific ASD CAM therapies that you don't know much about, you can always use the resources provided here during point of care. So, next slide. So also feel free to message me or refer to me if you need extra support for via consultation for these families. You would refer to St. Luke's Children's Integrative Medicine for that. And also feel free to check out my YouTube channel for free resources and webinars for providers and families. I plan to post some more things here soon. Yeah, thank you so much. And then there's just references at the end too.
That is fantastic. Thank you so much, Brittany. We really appreciate all of your information. And we did have a question that came in the chat. Can you talk about if you know about any advocacy groups that are related to insurance covering more or some of these therapies?
Ooh, that's a great question. I do not know the answer to that. I wish that they did cover more of some, these things. I don't. I do think that, yeah, because there's small studies and they do get sidelined. And I don't know. I mean, I know parents do try to go to like Katie Beckett or other like what's like funding buckets that they have. I've never had anybody be successful in getting anything, covered. But that's great. I wonder if there are. I don't know. It's a good question.
Can you speak to zeolite? That was one that came up recently for me. It was, yeah, we want to do zeolite. Is it safe? And I really was like hesitant to say yes, it is. So I thought it was in the probably ineffective and probably unsafe category.
I have to say, I don't even know what zeolite is. I've never heard of it for autism.
It's supposed to be removing heavy metals, and it's used as a drying agent in products commercially, like in industry. But this family, there are the claims that it helps in autism care. Like cleanse the body safely and effectively.
Right, like a chelation kind of like do it at home chelation therapy.
Exactly.
type of
And
thing. Yeah.
yeah, it is not exactly cheap. $169 for like, I don't know, those are tiny little bottles.
Yeah. I think I don't know how safe it is, but I think it's probably in that we don't have any evidence to support that it's going to do anything. But it's actually hasn't come up yet. I learned something new. I swear every day somebody brings a new thing to me that I haven't heard of. Um, yeah, and I mean, I'll go to some of those resources I mentioned and see if there's anything out there that, and then I'll look in PubMed sometimes if I haven't, or, see if there's anything. But just kind of doing a quick Google right now, just seeing that there are dietary supplements that are marketed to treat cancer, autism, herpes. Sounds a little too good to be true. Yeah.
Tom, that actually came
I
up in my clinic like 2 weeks ago,
Oh,
zeolite.
really?
I had no idea what it was. I had to look it up. I actually found Sloan Kettering has a herbal database, which I found quite helpful. I can put it in the chat.
Yeah.
I'd love your feedback, Brittany, if you've ever heard
Yeah,
of it.
I
What
have.
you're talking about? Yeah.
Yeah, I've actually used that look as a resource too.
Yeah, I will put it
Hmm.
in the chat for everybody because this is where I got in the zeolite I read causes pulmonary fibrosis. So I was a little, I actually contacted the family and I said I would not continue that.
Uh-huh.
And I think I referred them
yeah.
to you. So,
Yeah, there was an IH article on the pulmonary fibrosis, I believe, with the zeolite, and that was what I found. And I was like, no, let's not start this.
yeah.
Yeah.
Brittany, do you have any kind of like, do you have an age limit for kids that can come see you, or like how young do you see? Because we see a lot of
Yeah.
like 2-year-olds, right? And parents
Yeah.
are wanting to try stuff, and
Right, right, right.
I really
Yeah.
don't recommend trying anything yet, right?
Right, right.
So, but what do you guys, what do you see? What do you guys see?
Yeah. We right now are doing referrals for 5 to 18.
Okay.
And I have definitely seen children under 5 before, and it's more parent consultation, like for infants and toddlers. When I came here, my practice got so full so fast, and there's only one of me that, along with our practice manager, decided to figure out some limits and try to figure out how to. And we thought, working with patients that were of age to engage a little bit more around what we're doing and some of our services rather than having infant and toddler kind of age group. But if my referrals died down at some point, I think we could open it up to more. Like if you have somebody who's kind of on the cusp of like 4, a little bit younger, you can always ask and see. Um, yeah, like I like for a couple of people, we've gotten a couple of exceptions through for slightly younger, but
Yeah, great. And
I
are
wish we
you,
had the capacity to do it. I
yeah,
mean, and I used to see kids to like 25 or 26 at UCSF, but that's because they allowed it there and it was more common for peds providers. All of the kids with chronic health conditions there were still seeing their original pediatric provider. And here, I think it's a mix of just not being, I think they want me to, I think the highest is maybe 20. I can't have a new referral that's older than 18, but I can keep working with somebody who's already working with me up to, I think it's 21.
okay,
Yeah.
great. Are you guys receiving or accepting e-consults?
Um, e-consults, like provider to provider type e-consults.
Mhm.
We
Yeah.
don't,
Okay.
we don't have that. And I don't know if there's any, I don't know. We haven't ever talked about it. I'm not sure how it would work. Is that something that are you doing it for
Yeah,
other? Yeah.
we just started doing it in developmental peds, and
Yeah.
it's been great. But I think we're kind of like in the piloting stage right now. But I think it'll
Yeah.
get stronger. But yeah, I think that's a great idea to help. Just
Yeah.
these little questions that come up from families, and sometimes I don't know what to do next with them. So, and I
Yeah.
don't necessarily know if they need a full consult with you, right? To take
Right. Right.
and your wait list and everything. So,
Yeah.
yeah.
How does it work? Do the e-consults come up on your like patient schedule or how does that work?
Just via InBasket on Epic.
Oh, it's MBasket. Okay, got
Yeah.
it. Got it.
Mm-hmm.
Yeah, you can always send me a message over, Epic, just a regular message and CC somebody's chart and ask me if there's something you have
Great.
a question about. But yeah, so that works.
Awesome.
Yeah.
Thank you. Yeah.
Yeah.
I have a question.
Oh,
go ahead.
Go ahead, Julie.
I was going to say, what's your advice with so many of the parents are like looking for that sexy cure-all that's going to cure their child of autism, primary care providers have a short amount of time with the parents. Like, what is your highest and best way to help them navigate these things, because they have a short amount of time to talk through them sometimes with the parents.
People who are looking for some cure-all type of thing that's maybe alternative.
Yep.
Yeah. I mean, I usually tell people when I have my first visit that, you know, my goal is to help optimize your child's functioning in any way that we can, and to provide safe ways that are also science backed for that, and that there isn't, fortunately, autism is tricky. There's nothing, we don't have a cure for it. And I haven't found that people have come to me specific. That was always something I was concerned about. And when I first got into this kind of area back in like fellowship, was that people are going to come to me going, you have the answer, like you have the miracle solution. That's why you're here. And I don't have that. So I mean, it's funny, I haven't gotten that as much as a question, but I would say that as much as I thought I was going to be honest, but I will tell them that, you know, my goal is to help optimize, but we don't have it. There's many pathways that probably lead to this diagnosis, and that makes it tricky to sort of treat in a way, but there are things that we do know that help. And my goal is to help with, you know, improving the quality of life and functioning, neurocognitive functioning as best as I can with whatever we do know, but there's no silver bullet, unfortunately. Yeah.
Brittany, can we squish one more question into our time here?
Oh, sure.
Okay, so from Alena, what's the thought on the effective interventions that the effective interventions are having on secondary impact on ASD symptoms due to reducing anxiety, GI pain, etc.? Did you follow that? Sorry.
Want me
So
to
what is the
clarify
thought?
that?
Yes,
Want me to
please.
clarify that? So my thought is, like, there's been some other mentions in the chat about craniosacral therapy, massage. And so some of the things, some of the resources that you cited about, okay, these are the safe and effective therapies. I'm wondering, is it really targeting ASD symptomatology in particular, or is it really targeting kind of more of the secondary kind of comorbidities like anxiety, GI pain, those kinds of things? And therefore a child is feeling more settled because they're having some of these secondary benefits, and hence they feel a little bit more open to interacting and engaging, or, you know, trying things that are more distressing for them.
Yeah, I think that's a great question. I think that some of the dietary interventions seem more correlated potentially to what you're talking about, having secondary effects, say on GI, like constipation and better, probably gut microbiome, microflora, better movement of the bowels. But some of the like folinic acid that I mentioned, or methylated B vitamins, some of these the research is looking more at core autism features. So, and language and communication improvement. And so I do think that, you know, based on some of the small studies we have on some of the supplements that I mentioned, there is more information around potential help with some of the core features. But I do think that there are things like melatonin, which shows there's some, you know, it's helping with sleep, which then, you know, if your sleep's better, you're going to have better daytime behaviors and lower anxiety levels probably, and just functioning better. So I think that you know, magnesium is one that can be used for a sleep aid, and like that, you know, I think if you're using that, it's probably maybe, and you're getting some help with sleep and some anxiety reduction. Yes, maybe that's why we're looking better, feeling better. But yeah, some of the supplements have really targeted core autism features as the outcome and have shown some improvements there. So I think it's a mixture basically of what you're saying.
Great. Thank you so much for all of your information. Obviously, it's a very interesting topic that people are wanting more about. I'm going to wrap us up today. Thank you.
Thank you.
While we wrap up, I'm going to make one more plug. We've pulled together a list of neurodiversity resources that Hong Yan's going to put a link to in the chat. So that is, and we can mention that again in our next session, but a great list of resources. We're going to come back on October 10th from 12:30 to 1:45 Mountain Time. The topic is feeding therapies for children with ASD. And we have another guest presenter, Courtney Slett. She is an MA, CCSLP, pediatric speech language pathologist from St. Luke's. So we look forward to seeing you on the 10th. If there are any follow-up questions reach out to us and we can connect you to get those questions answered, knowing that there were some as we wound up today. Brittany, yes.
Oh, I just wanted to say I'm reading through some of the questions that were on there. I just wanted to stress going back that the examples in my slide for safe and possibly effective supplements are examples. There are some other, I didn't get to somebody said role for vitamin D. And there's some research around oxytocin spray. Like there's some other stuff, but I didn't feel like this was a talk where I could it wasn't the point to cover all the different therapy alternatives, more about like how do we support families and making good decisions in this area. So just know that there are some other things too. So I wasn't comprehensive in everything that has some data. Yeah.
Wonderful. Well, it was very, very appreciated. Thank you so much.
Yeah,
okay.
Thank you.
We will see all of you in October. Take care. Thanks. Bye.